Well, we're presenting here at this meeting for the first time the results of a study we call Hybrid. This is a study of hypofractionated radiotherapy using adaptive radiotherapy techniques in elderly patients with bladder cancer. In general practice, the bladder cancer becomes commoner in older patients, and we have many patients referred to us who have muscle-invasive bladder cancer, which is potentially curable, but they're older and less fit, and they're not fit enough for standard therapies such as radical cystectomy or even radical radiotherapy treatment. We have over the last few years designed a treatment which is to give 36 gray and 6 fractions weekly over a period of 6 weeks. At the same time, we're aware that standard radiotherapy is inaccurate in terms of delivering treatment to patients. Because the bladder is distensible and mobile, that means that there's a high rate of geographical miss with standard radiotherapy techniques. Over the last few years, techniques of using image guidance based around cone beam CT scanner become available, and we've used that to design a treatment called Plan of the Day radiotherapy, which allows us to select the best plan each day for a patient. This is particularly important in patients who are having a weekly treatment, where a miss on a particular day can represent a large proportion of treatment. So some of the blurring that you get from a more daily radical treatment is less available. So we did some pilot work suggesting this actually significantly improve coverage of the bladder and reduce the target volume. And we've taken that data into a randomized trial where we're comparing standard radiotherapy versus adaptive radiotherapy, based around a skeleton of 36 gray and 6 fractions. And our aims in this study are twofold. One is to test whether 36 gray and 6 fractions is tolerable and effective in this patient population. And the second is to test whether get some indication whether adaptive radiotherapy improves outcomes. So the Hybrid study is a relatively small study. It recruited 62 patients. The patient population is quite elderly, so the average age for patients in the study is 85, and a large proportion of patients are PS2 or PS3. Despite that, the vast majority of patients got through the radiotherapy. I think there was a total of 5 patients who had less than 36 gray and 6 fractions. And the key endpoint of the study that we had was acute toxicity during the treatment up to 3 months, and we were looking for emergent acute non-GU toxicity to look at the difference. And we found that the rate of that toxicity, that definition, was low in both arms, but lower in the adaptive rather than the standard arm. Though this is a non-comparative study, so we can't make direct comparisons between the arm. But what we did show is we met our primary endpoint of that toxicity.